Hi everyone, my name is Lainey Rand and this is going to be my video for my case study part 1 for medical terminology, and I'm going to go ahead with my video and be speaking as if I was talking to an audience of health professionals. So, as a gastroenterologist, I specialize in diseases and disorders of the digestive system. I serve a vital role in the well-being and best possible health of veterans in my community suffering with digestive system diseases. The digestive system is obviously vital for our survival. Numerous functions are to be carried out by the system for us to continue on with life. So I'm going to go into a more a specific disease of the digestive system that I see most of my patients for, and this disease is called gastritis. So gastritis is known as inflammation of the lining of the stomach and comes in two forms. An infection or inappropriate diet usually is the cause of the acute form of gastritis that happens suddenly. The more chronic form of gastritis is thought to be caused by bacterial infections, peptic ulcers, or gastric cancer, and this form develops more gradually over time due to the severity. If the inflammation of the stomach includes one specific organ or multiple organs, the name of the disease is altered. For example, gastroenteritis is the name used if the small intestine is included in the inflammation of the stomach. The small intestine of the stomach is broken down into 3 segments, which most of us all know. When inflammation of the stomach specifically includes the first segment, which is also called the duodenum, the disease is known as gastroenteritis. So for the third one, the altered name of this disease is if the inflammation involves both the small intestine and the colon at the same time. And this is going to be known as gastroenterocolitis. So gastroenterocolitis is, like I said, for multiple organs. For most patients that I see, gastritis isn't serious and improves with treatment. Signs and symptoms of gastritis include indigestion in the upper abdominal region, nausea and vomiting, and other symptoms include bloating, that feeling of your stomach being full, and then pain. I constantly see patients with gastritis, but normally at the acute form. So this form, like I said, can easily be reversed with medication and lifestyle changes. The lifestyle changes get pretty tricky, though, depending on how strict that patient is with the changes and, not cheating or anything. So what I commonly prescribe as treatment is diet changes consisting of smaller but more frequent meals. So not those large meals, like 3 times a day, but like more snack-sized meals. No alcohol consumption, no caffeine, and switching pain relievers if on any. And then Jimbo is a name of a patient I currently see at my clinic for gastritis, the acute form. Jimbo is a Caucasian male, 55 years of age, and after returning from his last deployment, he is said to have a low economic status, or socioeconomic status, leading to him making poor decisions when buying food, just due to kind of his education on what the food does to your body, the effects it have, and then money as well. So Jimbo is currently overweight and copes with back pain and anxiety, and copes with it by taking pain relievers. He has a past medical history of high blood pressure and severe back pain. And after talking to my patient about his medical history and performing an exam, I assumed that he had gastritis. So an endoscopy was then performed, And during this procedure, a suspicious area was found where a biopsy was then done. And the biopsy was taken to the laboratory for further examination. And H. pylori was found to be present in the stomach lining from the biopsy taken. And for treatment, I prescribed antibiotic medication to kill this bacteria. And then, well, that's what I first did. And then my patient was given a list of lifestyle and home remedies to take home. Included in this list, I made clear that no alcohol could be consumed, no caffeine, and then Jimbo was instructed to make healthier diet choices along with eating smaller meals more frequently. He was given a list of food to avoid, and then a list of food that were safe for consumption. And then recommendations also included drinking clear fluid and getting plenty of rest. I didn't want him to take aspirin or ibuprofen because that can irritate the stomach lining. And then no medication should be taken by mouth unless directed by a medical care provider. Also, like if he was getting the cravings to like have coffee or tea or different things like that, like clear liquid could be like also like chewing on ice chips. I always recommend that to my patients as well. I believe that there is a need for health education and additional research to help combat the problem on a broader scale. I recommended, and I do recommend, that the public be updated with this disease. Little knowledge on the matter is causing people to make common lifestyle mistakes that could have easily be prevented in the first place, just by their food choices and constant consumption of the same thing. Not switching pain relievers out, like taking the same pain reliever over and over and over again. Not drinking enough water with pain relievers. There's so much stuff that you could be doing to prevent this in the first place when you hit that older age of adulthood. Numerous patients I see for gastritis have had several symptoms for a month before even coming to see me, and waiting this long while the symptoms worsen lead to farther damage. So each person affected by gastritis will have different reactions to different types of food. So food to limit and avoid and food that is okay to eat should be provided to all adults reaching elderly adulthood, and then also just letting, maybe even teens and young adults know about these things, have it posted in the doctor's office, give each person that comes in the doctor's office pamphlets just on, things that we might think to be common sense, but for people that aren't educated, or never took the classes that we took, or, never educated themselves, would, just not know or think to, or, question it. So, I really think, though, that elderly adulthood that have poor diets and are overweight or regularly take pain relievers or consume alcohol just in their medical history should definitely be given all this information as precautions and prevention plans. Thank you so much.